Well, hello everyone. I'm glad you could join us tonight. We're going to have a fun evening tonight, learning about some other things. And I'll just mention we're looking at diabetic complications tonight, TMJ pain. That's here the joints, and a lot of people have trouble with that. Talk a little bit about oral health and something that's very hard to pronounce. Dupuytren's contractions. That's when you start having a finger coming in, and there's a rope that comes in here, and we've been able to see that as well. We'll be talking a little bit about autism, as well as we got one really neat new video on eye health. So we'll get that started in just a minute. Yeah. So anyways, we're going to start off with our first little intro video.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
So tonight we're going to also, as I mentioned, talk a little bit about autism. And one really cool thing that we've learned this last little while is that autism can be helped with light technology. And in particular, I had a person, a young woman that's a speller. So they type on a little keypad what they want to say. And so I managed to squeeze in, as I was in Buffalo. I was able to, before our airplane flight was supposed to leave, we managed to squeeze in a treatment in Buffalo. And this young woman has had a couple of them, and she typed on her little keypad there, and she said after doing the treatment, she wanted to say, and it read back to me, I heard it, and said, "You guys are a real blessing in my life." Wow. If that doesn't get the tear ducts moving a little bit, I don't know. But the mother proceeded to tell me that a few days earlier, she asked her daughter if it was what she thought of the treatments, if she wanted to continue. And she says, "Yes, I want to continue." And then her mother asked her, the next question was, what is it like? What do you think you feel? And she said, well, it feels like I can think clearer. somehow she said something along that lines. We got it fully documented, so so if I change the word or two, it's very close to what was said. And then her mother asked, well, what do you think this relates to? How could I understand what it feels like for you to have this? She says, well, it probably feel like if you were deaf your whole life, and for the first time in your life you could start hearing a whisper. That's what she made in the comment. So I was blown away. It was the best thing that really neat that happened that afternoon. I did end up squeezing too much in, and with traffic and a few other things, I missed my flight by 5 minutes. Okay. Now I didn't want to try and miss my flight, but so the next flight, so we're trying to fly to Atlanta to it's called a big conference called the Independent Medical Alliance. The uh, um, whole not theory. Their line is that they are pushing for honest medicine. But anyway, since I missed that flight, we managed to catch another flight, which was about a half hour later, 45 minutes later, from Buffalo. This time it wasn't going to arrive in Atlanta at 9:30. It's going to arrive in Atlanta near 12. Okay. All right. So be it. It happened. It was great to be able to help this young woman. But the flight proved to be very interesting because we got into Charlotte and got onto the next flight, and we all got into the plane. And then the captain came on and said, looks like we're not going to be able to, it looks like we're not going to be able to take off. Can't start the engine. And we got to do a manual start, and we can't do it at this part of the terminal. They basically flew the airplane into the wrong gate. Not his fault. Somebody just lined them and they couldn't start it. So, well, they were going to try and get another flight. And so we were going to fly out first 11 o'clock, and then 12 o'clock came up on the screen. And that's when we decided that then we saw it pop up at 6 o'clock in the morning was the next boarding time. We thought, that's it. I don't want to miss any of these important meetings that were there. There was there was around 400 doctors, nurses, dentists, and other professions, including some pharmaceutical people. And these are all people that are really interested in honest medicine. Compared to some of the stuff that's gone on in the last few years, they believe in real science, not the science that was jammed down our throats on some things. But anyways, regardless of that, we ended up deciding to take a taxi from Charlotte to Atlanta, which ended up being another, get this, like 4.5 hours in a taxi at that time of night. And what was really cool is maybe my flight was delayed for a reason, because we ended up treating a war veteran, a younger guy, but he was all busted up because of the war. And he actually was on leave, like he didn't, because of his pain that he was suffering all over his body, different places. And in the gate, while we were waiting to find out that our flight never would leave, he was treating his knee with the light, and he says, I think it's feeling better. And he says, yeah, it is. And then he started treating his neck, another area of pain, and that went away. And he said, normally, like, this pain just kind of keeps going. So in this case, what happened is we developed a little bit of short-term friendship there, and we decided together, why not go and take a taxi? So we did. That is the biggest taxi bill I've ever had. It was $800, 800 and something dollars. But we were able to split it in half, and we're hopeful that we'll get some credit for. They're supposed to give us some credit for our extra expenses. I did get into the hotel room at 5 o'clock in the morning, a little tough on the brain, and slept for 2 hours and got ready for the first meeting at 8 o'clock. So I was really shy on sleep, but was absolutely fantastic down there. So we're going to start right now into our videos. So let's go for the first one here.
So this is your third treatment, Logan?
Yeah.
And Max, you're helping?
Yeah, we're going to start 3 days a week.
3 days a week. What have you noticed with Logan so far?
So far, we've just with the amount of self-induced behavior that's done, he's really calm right now.
One thing that's been going on a lot lately is he is like attached to me, and it gives me anxiety. Like I'm talking, he follows me everywhere I go. He's leaving me space now. He's down in his room watching his videos, and he comes up and gets a snack, and he goes back down.
Yeah, so we've noticed that with some other people with autism as well, like clearness, responsiveness.
Yeah.
Can I get a fist bump?
There you go.
Awesome, man.
I don't know how to explain it. I can't get the words out, but we've noticed a difference. We've noticed a difference. Absolutely, yeah. All right, you want to say bye?
I know that's very, very short, but that individual couldn't make two appointments in a row just because of the weather and some other scheduling problems. But he's come back in again, and the coolest thing is he's still holding with the same improvement. So even though he hasn't had a treatment for a week, he's still holding with that improvement. We also had two other autistic boys in today, and I talked to the father, and although we don't have a recording for you, he said just even this is their second treatment today. I would say they're I don't know how you put it on the scale, but deeper in the scale of autism, and having difficulty in that. And he said the best thing is they're sleeping better, and they're much calmer. Both boys, and one's 19 and one's 20 from the day. So this is something that I understand. Like I don't understand, but I mean I understand is very, very important to parents, is just to have some additional calmness in their routine. So one thing I did learn, I was on and I watched a webinar that was put on by Steve Kirsch, and that was about two and a half weeks ago. And they had a whole panel of people on this thing, of the doctors and those that are specialists, and they were talking, and I have no real strong understanding of the area of autism. And I guess maybe on the scale I might be like that much understanding. But what happened is I thought, I wonder inflammation, if there's a connection to inflammation in the brain. And I did one of those super chats, where you pay $10 and at least your question gets asked. And so my question was, what is the relationship between autism and inflammation in the brain? Is there, like, what percentage is of how many percent of kids that have autism, or adults, it's related to some kind of brain inflammation? And they all went like, yeah, like that's the whole deal. Like one of the major parts of autism is inflammation in the brain. And then you get one of those aha moments, where, oh, and it turns out that Parkinson's, strokes, concussions, many of the other diseases, traumatic brain injury, there's the whole list of different kinds. Most of them if not all of them, have a relationship to inflammation in the brain. And I just now have come back to thinking about this is I don't know how many out there that have watched this or saw the movie The Ghostbusters. Well, we're the inflammation busters with our technology. So we can actually use light to help reduce the inflammation, whether it's in the brain or whether it's in the hand, whether it's in jaw pain, whether it's in the knees, all kinds of areas where in in the body, and many diseases are related to inflammation. Another term that you'll start hearing about is to do with mitochondrial dysfunction. And mitochondrial dysfunction is if you looked at this being the cell and there's the mitochondria in there, that is the power plant to make the power or the energy for the cell, very key for all the reactions that are going down and happening inside the cell. If that mitochondria is starved or it's locked up and it's not functioning properly, they say all diseases or almost all diseases are related to this mitochondrial dysfunction. It's not processing whatever it's supposed to do. There's electron chain transport and other things, which I know very little about, but it has a way, light has a way of not feeding that mitochondria with energy. And one of the other fellows that I know likens it to ungumming the cell. So next we're going to go with diabetic complications, and here we go.
We always hear about people, unfortunately, with severe diabetes having toes amputated. They'll start with the big toe, then they'll get the next toe, then they're going to take off the other ones, and then it goes to the foot, and then unfortunately, sometimes, below the knee, and then other times the whole leg. And this is one of the best uses for PBM. So here's another case. On the top left, this is the initial photo. This big toe was scheduled for amputation. Now, why do we get all of this neuropathy? And it could be either from chemotherapy or it can be from diabetes. We get this because we have a decreased blood flow to the area. What did I say one of the great benefits of PBM is? Increasing blood flow, increasing lymphatic drainage. So, this person did not want to get her toe amputated. She once again went to a med tech facility. By the way, this toe was treated for 3 months by traditional wound care. Well, now you can see her immediate one. And after 6 weeks, look at that difference. No longer needs an amputation. Why? We increased the blood flow to the area and it healed. This is a study that was published in Lasers in Surgery and Medicine. It's called Phototherapy Promoting Healing of Chronic Diabetic Leg Ulcers That Fail to Respond to Other Therapies. You'll see the name in red on the bottom, Dr. Kachuka, an excellent researcher, really is. So, what they did is they combined 660, which is red, 890, which is infrared, as LED, and they did these together, and they had 28 cases. So they did 14 that just received traditional wound care, which was 1% silver sulfonamide cream, and they did a placebo laser therapy, which means you put the laser on, into the area so the people think they're getting it, which is great when you're trying to get a study result. So they think they're being lasered, but they're actually not. And then the other 14 got the silver sulfonamide, and they got active laser, 3 joules per centimeter squared. This was done twice a week. Now, from here, what they found, the laser group had significantly higher ulcer healing rates. faster healing by day 30. By day 90, 58.3% of the ulcers had fully healed. 75% had achieved 90 to 100% healing. Think how great that is. Now, also, you heard me say both groups received the traditional treatment. One did it with the laser. And that is another wonderful thing behind this. This is not, well, do I do laser or I do traditional? Laser works symbiotically with the traditional treatments. It could be for herpetic lesions, aphthous ulcers. Doesn't matter. It's not one or the other. Put them both together. It's the old two heads are better than one. So, their conclusion, combined 660 and 890 light promoted rapid granulation and healing of diabetic ulcers that had failed to respond to other forms of treatment.
So this slide on the left-hand side, diabetic ulcer, this person was going to have their foot amputated it was already scheduled 1 week later, and they managed to get the light into the hospital, and she ended up treating her area 3 times a day with the Super Palm 1050. And the neat thing was, by the end of the week, they saw such an improvement in the area they canceled the surgery. And on the right hand side, you see 2 months after this initial picture, and it's almost all healed up. And there was another month later, and it just closed right down. So she was able to leave the hospital walking on a foot that would have been amputated if it wouldn't have been for the PBM being used. So it's absolutely the worst possible condition with diabetes to try and heal somebody. And here we are, improving the blood flow, improving everything in that area so that it can heal, and the body can go ahead and go full force at healing the areas.
Yeah, it's really fantastic to see how this can improve blood flow through the feet and helping to heal the wounds. One thing that was Dr. Jerry Ross, a fantastic dentist who had learned about PBM. I think it was like 30 years ago, using laser. So he refers to laser being used as a light, but as a matter of fact, our device produces photons just like a laser does. And as a matter of fact, we were able to do a presentation in England where if you had a laser and you had an LED, the amount of energy that goes through 2¼ inches of steak. So we put light on top, and you have this big chunk of steak in between, and you have a sensor underneath it. We found out that the amount of light that came from a laser at 5 watt, a 5-watt laser, which is pretty expensive, or our palm device on top of that stack of steak, there was no difference of light energy coming through the two. There's still a very good measurable amount of light, but it made it was very, very little difference between the two. What was a big difference is the laser was about $25,000, and our device, the Super Palm, is $1,900. So it makes it far more affordable to get enough energy through a thick amount of tissue. So if you're trying to treat your knee, you need to have enough light to go into that depth. So what we're going to do coming up here next is to deal with TMJ. But just before we go there, I'll just mention, because in the beginning, the beginning of sales, I started working with a lot of dentists, and the reason being is dentists are the ones that have had lasers for pretty much the longest period of time. Some chiropractors started buying lasers, but it wasn't commonplace to have lasers in chiropractor or physiotherapists. But in this case, with this kind of light being available, I started connected with somebody who allowed me to do webinars with them, and we were able to have dentists using this light for TMJ purposes that way, with a red and near infrared light. But also the request came in as far as they wanted to have the light come through into the mouth, deeper in the mouth, so that they could treat the back sections of the your molars and that. So we developed this we call it this adapter plate with an oral probe that dentists could use. So now they could put this in the back of the mouth, and you can see they could apply the light onto the back area of the tooth. That is available on our website as well. And you can, all you do is you put it in, line it up, and you put it into the hole that of what wavelength you're going. So one hole is for the 660, the other hole is for the 810. Or if you bought a Super Palm, this second hole lines up with the 1050. So this is a very useful device to do inside the mouth to get a higher concentration of light. And we developed that as well. All the devices that I'm showing you here, well, as a matter of fact, I don't have the devices here, but right now, but maybe they'll end up coming in here just by magic in the next little while. And I'll be able to show you some of our devices. But next one we're going to go into is to do with TMJ pain. But I just say Dr. Jerry Ross was one who traveled the planet with two other individuals, Mel Birchman and Arun, teaching dentists to use PBM. And they just love the light that I have because it's affordable for even their patients and friends to buy them, as opposed to the very expensive lasers. So now what we'll do is we'll go to the next video here. Can PBM help to reduce joint clicking? And this is by Dobek.
Sure, absolutely, because we now go back to what is the clicking and crepitation. So the symptoms of temporomandibular joint dysfunction, it's pain, it's clicking, crepitation, which is the noise during opening and closing, during chewing. So all this, these are really symptoms happening during the process of eating, and that really can be reduced. And how that be reduced? Because as you know, why the patient have a clicking? Because the fibers of the muscles are really under very increased tension and inflamed. Therefore, they are not easy. It doesn't have any elasticity. So there's a lack of elasticity of the fibers. When you use photobiomodulation, reducing the inflammation, allowing the fibers of the muscle to be more loose, to allow the joint to open, to allow the muscles to open the mouth without having any clicking, because the clicking happening, the muscles are the fibers are very tight, and you're trying to open the jaw. So these are really, really rubbing the fossa itself because of the muscles are under tension. Since you release the tension by decreasing the inflammation and increasing the tensile strength and also the collagen remodeling of the muscles, so basically that will help to ease the tension and allow the patient to open the mouth very wide without having any clicking. However, having said that, if the patient having clicking, but at the same time has a deviation of the jaw to one side to then the another, I think at this stage you need to step back and think. Sundial, or there's any degenerative condition happening here, you might step back. Maybe I need to do MRI scan to establish this diagnosis, and upon that you can really see, can I use photobiomodulation for decreasing the degenerative condition that the patient is experiencing. So it really is very useful to look at what is the causing this clicking, and also looking at the condyle in terms of it is deviated to the right or on the left side during opening and closing.
What areas are you hoping to use, or you've heard about already, that people use this light therapy for in the dental applications? I know I've covered some ground, but from your own perspective, and what are you hoping to do as far as treatment in your practice?
So I'm hoping to, as I'm now expanding into oral medicine within my own scope of practice, we'll be helping patients with various erosive and ulcerative conditions, things like lichen planus, again, oral mucositis, aptus ulcers. We can accelerate healing for a lot of those patients. Basically, anything that presents with non-malignant ulcers, there's a role for this. Within the TMJ realm, as we've talked about, whether it's muscle or joint pain, we'll be offering this to patients as well. And it'll be interesting to see what happens with the hyposalivation patients too. So those are really my main three. And then in the oral surgery realm, certainly there's some good early evidence that you've touched on, Tom, that wound healing and bone healing in particular can be accelerated with this. So we'll start using this routinely in a lot of our surgical sites and see if we can measure some differences.
There are two things happening when you have temporomandibular joint disease. It's related to mechanical stress and also the neurologic inflammation. If the mechanical stress, as the joint basically, what we move, how we chew, it's really the condyle is really moving into the fossa in order to open and close our mouth, and there's a muscles of mastication allow us to do that, even help us with the chewing process. So there's a mechanical process happening in here, and in that respect, in patients with TMD, they have hypoxia. There is a debrivement of reperfusions of the respiratory chain of the mitochondria there, so that leads to more of the free radical production that causes the pain. So also in terms of the inflammation, there's a lot of a production of the pro-inflammatory cytokines, the interleukin 1 and 6, that really contribute into the pain and inflammation at the site of the joint itself. So photobiomodulation helps to decrease the noxious stimuli and blocking the C fibers, increasing more of the happy hormones like epinephrine, using the endorphin and decreasing the bradykinin and prostaglandin E2. That really helps to decrease the pain itself, and also decreasing the oxidative stress, increasing the ATP production that will help into the cell to proliferate and differentiate in the area. And also it helps to increase the collagen remodeling and the tissue elasticities in the joint and in the tendon itself, and also decreasing the inflammatory cytokines and decreasing the edema and increasing the lymphatic drainage, and also increasing the tensile strength of the muscle tissues. That's very important. So really have a great impact in order to reverse all the deficiencies that's happening in the condition. So in 2021, I conducted a systematic review and meta-analysis for me to understand what is the current research about the use of photobiomodulation in temporomandibular joint dysfunction syndrome, and also what are the results and where are the drawbacks in these randomized controlled trial, and how I can extrapolate the reasons and that happening, and also help me to establish a recommendation in terms of the dysymmetry, the trigger points. So if you're trying to irradiate the temporomandibular joint, we have to look at which areas we need to really trigger. In terms of, we need to trigger the muscles that really have an impact on that. So they have the muscles of mastication. So majority of the studies have irradiated the masseter muscle, pterygoid muscles, and also looking at the temporalis muscle. And however, there are some of the very, maybe couple of the studies have looked at the cervical muscles, while the others haven't really irradiated the cervical muscles. What I mean by the cervical muscle, looking at the trapezius muscle, the sternocleidomastoid muscle, and also the digastric muscle are very, very important because these muscles contribute into temporomandibular dysfunction symptoms. So basically what I'm talking about the trigger and affected point, that's very, very important. The papers that I have really reviewed, they're much not being respected in terms of number of the trigger point and also the allocation of the trigger points. So trigger point and affected points are two different. Trigger point is where patient tells you, I have pain here. Where the affected, it's basically where is the originated from. And that's very important. It's like you have pain in the back of your thigh and really painful. And you think, okay, I'm going to irradiate that area where the patient's telling you the pain is coming from. However, the origin of the pain is the sciatic nerve. So you go further up, you go to the sciatic nerve, and that's where the roots of the pain, and that's where you should irradiate as well. So that's what is the affected side. So in terms of the TMJ, the muscles that need to be irradiated is the temporalis muscle. You have to irradiate where the origin and the insertion. So the origin is extraorally, you can irradiate, but the insertion of the temporalis is intraorally. So that has need to be taken into consideration. And also the pterygoid muscle, we have extraoral, while the originated of the medial and lateral pterygoid muscles are intraorally. Looking at the masseter muscle is extraoral, and also you're looking at the cervical muscles, which are extraoral. So these are very important to take the location of the trigger points, and also looking at an extraoral, intraoral, and also looking at the muscle itself, how big the muscle is. You cannot compare the size of the temporalis muscle, which is like a fan shape, to the sternocleidomastoid muscle or to the pterygoid muscle. So there are really things you need to take into consideration with allocation the number of the trigger points. Also, you need to take into consideration the thickness of the muscle itself. Some of the muscle could be very thin, some of them very, very thick, and also the composition of that muscle varies. Why I say that one? Because that will help you to understand which wavelength would you use. If you have a very thick muscle, maybe you need to use your power output should be more than a thin one, because that will help. However, also where it's seated, some of the muscles are very deep-seated muscles that you need to really may apply a pressure deeper in order to travel the photonic energy on to reach the target tissue. While, for example, using the near infrared to go deeper, that can have a deep penetration that can reach the target tissue. So choosing the wavelength, choosing the power output, your dosimetry, very important to be taken in consideration, depends on your trigger point that you're trying to irradiate.
Okay, so now you are more wise about TMJ. Quite detailed by Dr. Reem Hanna, a guest I've had on my show a long time ago, and extremely knowledgeable about PBM and the use of PBM for dental issues. And she actually ran the PBM conference in England, where researchers came from around the world. So next, what we're going to have is we're going to have a short thing on oral health, I believe.
People have fallen down on their face. Oh, people have fallen down on their face. And we have big black and blue. We stick it on there. I have been able to, I forgot, I didn't even write this down. A patient fell flat on her face. and she had a mouth guard that I'd made her, demolished all of her front teeth. We couldn't see them when she first came in. We stuck her guard in. We found her teeth. I used my laser, my photobiomodulation light on it every other day for 6 weeks. Everything healed with no scarring. She did not need to get her jaw wired. All the bones broke in the maxilla. Ultimately, we discovered number 11 over here. Number 11 broke in the middle of the root, apex, never had any issues. She lived for like 7 years after that. And then she just recently died. But all those teeth were vital. Everything was wonderful because we used light therapy and we used the guard. It was amazing. I forgot about that. So we've used that on her. Somebody's fallen down and hit a front tooth with a wrench or fallen down, and we put your little light, the
probe
intraoral tip on the gums and on the tooth, and the tooth has not gotten dark, and the tingling sensation disappeared. We have had a lot of good results with that.
Thank you.
Yeah, lots with the mouth. And go ahead.
Yeah, so as a matter of fact, I did a face plant into concrete. I fell face forward, and boy, did I really hurt myself. I lost my front tooth in the process, and the speed of healing from the amount of injury that I had on the front face. Now, I didn't actually have any x-ray or whatever, but there was an x-ray that was just done, and it shows that there was probably a couple bone breaks that I had in my upper area here, but I didn't know it. But it all healed up very well. And
it just heals. It just heals beautifully. It just does a great job.
My daughter, her daughter, my granddaughter, went and fell, and the whole area was all really bad looking above the gum, and she immediately used the light, and the color all came back properly in amongst above the tooth, and the tooth was very, very, very lucid. You know, it was she was young. I guess she'd be about 5. So didn't lose the teeth, and about a week later, she hit the same teeth again into something else, and she right away used the light, and the teeth have been able to make it through 2 traumas.
And I have a grandson who was 4. He had to have his tonsils out, and so when he got his tonsils out, it was painful, and he had the red light. He had the SPP, the SunPower Plus. He wouldn't open his mouth because he was kind of a little scared of it. And then so he put it on his back, behind his neck, cervicals. And you know, that quenched his pain. He didn't have to have all the medicine that was able for him. And he would put it on there 2 or 3 times a day and just sit there on the recliner with it behind his neck. And now every time he falls down, hurts himself, he gets your red light and sticks it all over him. And he just knows to do it.
All my kids, they had the wisdom teeth extraction. All of them have used the light, and so have their mates when they had their wisdom, and no painkillers.
Right. That's the way it was with his tonsillectomy. He was fine. He just, when it hurt, he knew to just run and put it on the back of his neck. Eventually, we got him to open his mouth, but he hadn't had it long enough to get used to it. Now, when he falls down, he just goes and puts it on himself. He fell down on his forehead. He just stuck it on. My son said a couple weeks ago. So yeah, they're very good with using it. So that's another oral reason, is for tonsillectomies. And we have many patients come in and use it before or after their oral surgery or tonsillectomy. We have people come in all the time, and I treat one trigeminal person with it. That's been eye-opening to treat trigeminal neuralgia.
Is the dental probe attachment necessary to treat intraorally? A person can use the light to treat from external. It's possible. Does take longer because it has to go through the thickness of the cheek. But obviously when you use the intraoral probe, you're able to direct the light right on the surface. So if it's a small area that you're dealing with, the intraoral probe works really great. If you have a whole area of your mouth that you got to treat with, it's better than to use the larger light like the palm device, and treated. And some have actually, if they have sores on their lip or inside their mouth and it's exposed, they can just open their mouth and allow that to happen. Okay, now we're going to talk about this Dupuytren contracture, and we'll just prop on the video for that.
Dupuytren. Anybody comment? I don't have experience with that.
Okay, I do. One of the chiropractors said that this person had it's starting to pull in, the tendons start. I'm not exactly sure. I can't remember, shrinking or something is going on that
contracting. Yeah,
contracting.
Correct.
And so the one, it was funny. You can tell people some things, and again, they won't listen. But I talked to this one chiropractor. And I said, look, both wavelengths are very beneficial. Use both, the 660 and 810. And so, but the 660, because it's so bright, it's very impressive. So he thought, what's that, dim light go, that's not going to do much. Well, what he told me is he called me called me afterwards to tell me, he says it was months later. His patient first got the treatment with the 660 nanometer and saw quite an improvement in his hand, but kind of just leveled off, and he wasn't making any other improvement. And the chiropractor was rather disappointed that it wasn't going the full. And then he says, I wonder if I should try that 810. So he started combining the 660, 810. The person got 100% back on their one hand, and their other hand still needed more time when I talked to him. So. There's a benefit to both of these wavelengths, and when it comes to 1050, you got a wavelength that there's even another mechanism that Dr. Michael Hamlin talks about. It's called, I know it's up for grabs as to the knowledge behind it, but I think someday we'll figure out what this other phase of water or structured water is all about. But Dr. Michael Hamlin talks
I think
about
that's
it.
pretty important.
So up there on that last panel was Dr. Margaret Naser and Anita Saltmarsh. Both of them have seen the results and have, as a matter of fact, Margaret's been a little closer to it, but has used the helmet, our SunPowerLED helmet, this guy here. And as the fellow called it last week, it's called the happy helmet. But it's got the 660 nanometer and 810 nanometer. And in this case, that's the 810 that you can kind of see there. But the reason he calls it the happy helmet is because he was suffering from depression and anxiety. And this is now he has no anxiety and no depression after using the helmet. He's coupling that with methylene blue, but if you want to learn anything about methylene blue, go to www.methyleneblue.red. Another website that is out there that talks about the benefits of the red light actually being used to activate the methylene blue. But we'll go on to the next video here. But now we're going to just have some. This is really neat how this turned out. Go ahead.
Hello, this is Pastor John Irving. I'm with Eldora, and she's had some amazing results with the SunPowerLED. Say hello, Eldora.
Hi.
And you've had it, what, 3 weeks now?
Yes.
And she has the ultimate palm. And what are the things that you've noticed in the last 3 weeks?
Well, better eyesight. The knees don't hurt. I'm walking without a cane.
Wow.
And I'm steadier on my feet.
Okay, let me just go. This is her daughter over here, Christine. All right, Eldora lives with her. Can you just expand on her
Mom's eyesight?
eyesight?
Mom has a macular degeneration, but it's the dry macular degeneration. There's no shots you can take for it. So Mom's eyes were going quickly, and she couldn't see faces. She couldn't see the TV anymore. She couldn't see far. Everything was closing in and milky cloudy. Since using the Palm Pilot, she can now watch the ball game, see the jersey numbers on the players, and baseball's easy to see now. She's seeing colors. She couldn't see colors before. Hockey's still hard to watch. Ice with white jerseys is hard to watch, but she is now seeing more than she's in the past year.
And Eldora, just say one little thing about the shampoo that you told us this morning.
Yes, when I went to take my shower, I always had to put it into a bottle or something that I could know how much shampoo I was getting. I could pour it on my hands, see where the was coming from, and see how much I had on my hand.
So you would recommend this to anybody?
I certainly would.
Thank you, Eldora and Christine.
Okay, now we're going to bring on Pastor John. Pastor John is the one who just did that interview with that elderly lady, and she's so happy to be able to see again. And there you are. Hi, Pastor John.
Hello again, Tom. Boy, this is going to be a habit 2 weeks in a row.
Yeah, well, I just thought I'd compliment you. Just did that interview for me so that you could catch the progress. She's a pretty happy senior lady, isn't she?
She's turning 95 in June. Isn't that amazing? She doesn't look it, but she's turning 95. And first 3 days, I said last week, she threw away the cane. 3 days, threw away the cane. Her knees, her legs are strong. She's walking. And she's come to church without the cane 2 weeks, and her eyesight is improving every single week. It's quite remarkable.
Well, that's a miracle to see that happen. To see eyesight come back. We got another video on our YouTube channel about a fellow that for 3 years was totally blind and now sees. But I remember, hey, the blind see. I mean, who are we to make a difference? But all we have to do is hand them one of these, and takes a little bit of the light, as I say, as Neil Boren says on his show. He says takes a little bit of the light that God created in the first place and uses it to heal parts of the body. And I'm just using a little bit of it, the wavelengths between 660 and 1050. And it's making a huge difference in people's lives with pain and inflammation and that, and even yourself to have your pain reduced. But it's amazing, isn't it?
Yes, I'm sharing and I'm bringing it to church, and people in the church are coming. And we had an elder yesterday we've known for 25 years, and she told me this morning she had a pain in her neck. Well, I thought, well, maybe she's had it for a week or a month or a little bit. This morning, we do a morning devotion with a bunch of people. And at the end of the meeting, she said, by the way, she's so excited. She said, I have had pain in my neck every single morning for 35 years from car accidents when I was a young person, 3 car accidents. Every morning, she has to kind of get up and move and try to get going in the morning. She has a hard time. And she said this morning, the first time in 35 years, after using the palm on her neck for just under 10 minutes, her pain's all gone.
And how many treatments was that?
One. One. That's amazing. I don't know if it will return. She needs more, but I told her I've got it right here. You can come and get more.
Yep. This is for those that are involved in their church. What a fantastic way of helping people within the church and outside of the church to improve their lives by using one of our devices. So I was just on a phone call with an individual in the States, and he had said that his church is actually looking at they've already started implementing ways of helping to with the community in the area of autism. And wow, to be able to make a difference in other people's lives without telling them they have to pay you $100 or $500 or whatever, and
Yeah.
get your next round of pills to bury the symptoms and just have problems that way. But anyways, Pastor John, thank you so much for coming on for a minute here.
Okay. Thank you. God
All right.
bless.
So at this point, we're going to get into some questions that people have. I know we're going a little later again, but it just seems to be the nature of things. By the way, this is not unusual to have a lot of questions come up at the end. But I just was invited on to a group of doctors in a Zoom call with a group of doctors in South Africa. And there's a mix of different ones, but mostly doctors. There was 35 on the thing, and I just came in for a cancellation. Somebody canceled, and they told me before. They said, "Well, if you can come on next week, we got this cancellation. We'd love to have you." So I went on, and he said, around 30 minutes for your slides, and then we'll take questions for 15 minutes. Well, I did my slides. It took me 35 minutes, a little longer, sometimes a little longer winded. Anyways, in the slides. And when we started with the questions, we ended up going on for another hour and a half on the Zoom call, which was the same day that I missed my flight by 5 minutes. So a few things happened that day that kind of shifted my time schedule a little more than probably I should have had. But yeah, so I just want to reach out to Russ. Please give me a call. Definitely want to connect with the fellow John Aaron. So please do that. Give me a call. You have my cell number. Okay. Sorry, I just wanted to get Andrew Meteorot. Okay. Yeah, so it turns out that this is endometrial. I can't pronounce it right, but I know what you're saying. It's possible that the light can also help for different glands when you're talking of swelling, because it helps the lymphatic system to drain properly. And anytime on the body you need healing, to help the body to heal, light can go in and help to help with the healing process and increase the blood flow, as you saw on one of the slides with the diabetic situation. And yeah, so let's go on to the next question here. Oh, by the way, if you weren't on last, if you were on last week, I was using the light on my cheek because I had a root canal done 2 hours later. I didn't need to take any painkillers. It did start to throb once the swelling wore off, but perfectly fine after that. It still had some swelling and used it for a couple days, and the swelling went totally down. Susan is mentioning, thank you for all these questions, by the way, everyone. But Susan's asking or mentions, I have treated my toothache with the light on my cheek and no ache. Yeah, that's a lot of dentists find that this is something that can help with swelling, inflammation, and to speed up the healing when you're talking of a tooth extraction or something like that. Marg is asking, how do you use it on your eyes? Very important. This is extremely important, is you close your eyelids. Okay, the reason you close your eyelids is because if you're on a beach in the summer you don't stare at the sun, do you? You close your eyelids. You don't keep your eyelids open. The optical power that we have coming from our light, the energy that's coming from it is a little higher than the total power from the sun. But the sun has also UV wavelengths and blue wavelengths and other green that have high energy, whereas the light coming from this is high energy in the photons, whereas this is the red is a lower energy in the photons, but we have an extremely high amount of energy coming out of this device. So what a person would do is close their eyelids, and the reason being is the light then would be diffused in all directions, reduced a little bit, and going in all directions, and that means you'd have a very even amount of light on the back of the eye, on the retina, so you're not going to cause any harm that way. But you do 1 minute of the bright red like this, and then you switch it over to the other wavelength, the near infrared, whether you have the 810 or 1050, and it's 1 minute of the red on each eye. I do have some cool reports of people having improvements in their vision, and it's been pretty neat to see. Some have been able to get rid of the readers. Maybe I'd be able to get rid of mine if it wasn't for the fact that I can't remember to do the treatment, or I don't take the time to regularly do a light treatment on my eyes. But okay, another question from Susan. Can you comment about the red light panels that other companies make where you sit in front of it? My niece has one, but I am sold on your product. Yes. Well, if you took one of those, trying to get this in, if you took, let's say the panel was, it always works backwards on the screen. It's really hard to coordinate your mind on things like this. But let's say you had a panel about this size that you bought off of Amazon, you'd have to shrink it down to this to get the same amount, same energy that you have coming out of this kind of thing. So you'd have to shrink it way down. But then our panel is like 15 times the area of one of these and 12 times the power of one. So 12 of these across our panel. So our light is not, the light power that we have from this is not stretched out over this big panel. It's all condensed. So you have a much higher potency of light. Okay. Yeah, do you put Demery is asking, do you put the probe right on the tooth? I have a tooth they want to pull because of the pain. I cannot now chew. The pain is gone, but I want to know where to put the probe. So it turns out that the probe can rest right on top of the tooth. Very, very interesting that the light properties of the tooth itself will transmit the light all the way down into the root. It's possible as well to put this right against the jawline, just below the tooth as well, inside and outside, can be helpful. But I'm going to say, just when you use this light, you just be careful. There's a lot of energy coming from this. So thank you, Dr. Heyman, for mentioning that there is a lot of energy coming from this device. And if you have sensitive tissues, even sometimes a darker skin, you may feel it a little hotter. So in that case, if it's a little too warm for you, just pull the light back a little bit. You'll cover a bigger area. It'll decrease the power intensity. So that's one way of doing it as well. You can shorten the time, or you can do shorter treatments, moving it back and forth or to different parts of the body. Brian is asking, Tom, with the helmet, have there been positive results with common tremors? Matter of fact, Brian, I'm not sure. That's something we will start exploring. I was at this meeting. I'm very excited to tell you that now this is not quite the same, but we're going to have new research that's going to be done on our helmet. One group is going to do research with autism. A senior lady that really knows her stuff in research and autism, and so they're going to do that with our helmet. We also have another group that's going to be doing. They have three clinics, and they're dealing with come on now, brain fog. So that's something that can be very helpful for that, and we'll actually have some real studies that show that. And another group is going to be doing a study with our helmet on seizures. So really, really neat. Yeah. So okay, so there another comment came out about when it comes to these panels, what do you get when you turn them on and you stand in front of them for a while? Well, you have to stand in front of them for a very long time to get even a little deeper in the body. If you just want to do there's masks that you can buy, there's other devices, but literally you'd have to be there for 6 hours probably to get the equivalent dosage. And even then, it might not be a high enough intensity to actually get any depth happening. You may get a dosage on the surface. You may use your panels to get rid of some wrinkles in your face or wherever. But as far as actually treatment into the hip or into a shoulder, that requires a lot more power. Okay, I think we're caught up. Well, I want to, DM is asking, have any testimonial on people healing their optic nerve? Not yet. It will be interesting. We have another study that's going to be happening, hopefully in the next 6 months. I've met up with a professor researcher, doctor in Israel, who has made it his life research on nerves, and he's been able to regrow spinal cord nerves. So that is fantastic, but he's now working with us, and will be doing work. So he was able to regrow spinal cord nerves on humans right now. But the process using a small laser, takes them 5 hours per patient to treat it. And with my lights, they could do it in a half an hour. So that's why he wants to work with me. Okay. Perry is asking, what about tinnitus? Yeah, we've had success with tinnitus as well, or tinnitus, however people like to pronounce it. And that would be we've had not 100% success. It's closer to 7.75% or 75%. We have 9 people out of 12 that have benefited from using the light on their ears. So that's like 1 minute of the red and 1 minute of the near infrared. For those who don't know what the term tinnitus or tinnitus is, that's ringing in the ears. And I've also had some report of actually some improvement in hearing, but that's only one case. So don't know what it was, but it's possible. So okay, and there was one other so when you're sitting further away from some of these light panels, even if you have it close to your skin, the power is very low, and by the time you get way back here, it's really low. Might help you with some melatonin production as well. It's interesting. There is a connection with red light and helping to stimulate melatonin. Okay. Okay, there's a comment by Dr. Heyman. If you get rid of tension, tinnitus, or fluid in the ear, hearing improves as well. So that may be the reason. thank you for your comment. Okay, well, thank you for all those that are saying thank you. Anyways, you have a great week. Tune in next week. I hope I make it back on my flight well. I'll be flying in early in the morning on Tuesday morning, so we hope that I'll be doing one of those red-eye flights, so I hope I get some sleep on the way back in, or I may be sleeping on the show. If you see me nodding off, that might be why. So listen, all the best. God's richest blessing on all of you, and bye for now.